All right, good afternoon, everybody. My name is Danny Contreras. I want to welcome you to this session of the panel Peer Support Specialists, Experience, Knowledge, and Recovery. The Hub and Spoke Making a Transformation Conference is funded by the California Department of Healthcare Services, the Opiate Response, and sponsored by Advocates for Human Potential Incorporated, AHP, Aurora Health Group, and the UCLA ISAP. We welcome our state opiate response, SWORD 3 Hub and Spoke grantees and other participants. Please turn on your camera. We want this to be an interactive experience. Few housekeeping items before we turn it over. In the chat, you will see some important housekeeping items. Any questions that you have during the session for the presenters, please submit them in the question and answer window. Please use the chat for comments only. Please be aware of your background noise and mute your line. We will have Chris Brown, who currently works for Encompass Community Services in Santa Cruz. He's a peer support specialist, having multiple years of lived experience, including experience related to homelessness, addiction, and trauma. After multiple years, he has been able to maintain over 9.5 years of sobriety and change the trajectory of his life. He is a father of 2, a recently married man, and a student. We also have Alicia. She is a single mother in recovery. Her path to recovery began when she found out that she was pregnant with her now 6-year-old son. She has experience with MAT in the form of buprenorphine. This form of treatment has helped her acquire coping skills to gain back control in her life over the past 7 years. In addition to her personal experience with substance use and recovery, she is also the child of an alcoholic. She has learned to cope with adverse child experiences and spend her knowledge and motivation on her own growth and on helping others in similar circumstances develop skills they need to overcome the challenges that the substance use disorder and mental health problems bring to her daily life. Her family and friends are her motivation to continue on her path to recovery. And then we have Helen. Helen, I know Helen for a long time. I know Chris too. Recovery offered Helen the opportunity to complete her undergraduate degree in psychology at CSU Sacramento. In the mid-1990s, she was invited to TA for Dr. Westbrook's Psych 117, which was an introduction to the complexities of addiction. The following 20 years, she has worked for Santa Clara County as a member of Juvenile Treatment Court Team, an innovative response to the needs of substance use youth with intervention. I can't even say that word.
Don't bother.
Community supervision and treatment. Santa Clara County has led to way with adult and juvenile treatment courts, which are still in practice today. And in 2004, she accepted a position in Essex County, UK, as the Commissioner for Essex DAT, management and oversight of the home office funding specific to improvement of service for youth. She returned back to the U.S. and has worked for the County of Santa Cruz as a mental health client specialist for the Children Mental Health, Homeless Person Health Project. In her off hours, she's worked as an announcer for the disc jockey for local alternative rock, jazz, and blues station. Her dog Finn, taking me for daily walks, keeps her moving. She has been living sober, life on life terms since 3/25/1985. All right. I would like to say before we get started, I hand it over to Chris. This topic is very unique and special to my own lived experience. Incarcerated for over a decade of my life. There was a substance abuse program inside prison, and I was hired as a peer mentor in there, and I did about 3 years in that program, and it was huge for my own growth and learning. For me to finally get out, I've been out of incarceration over 13 years now, and now I am the health service manager of the MAT program for the County of Santa Cruz. And so I know the importance of being able to connect with your peers, and our presenters today have a lot of lived experience, expertise, and they're going to share that with you guys today. So Chris, if you would like to go ahead and open it up with some of your experience, and then we will go to Alicia and Helen, and then we will give some space for questions at the end.
Well, hello, everybody. My name is Chris Brown. I'm a grateful recovering addict. I often present in scenarios that way when I speak at meetings or at meeting level, and I speak to my peers in that manner. And that's for me to be able to remove my own stigma to be able to address you guys today. I have to say that I'm a little nervous, but I want to first off thank everybody here for all the work that they've done and all the lives that they've been able to touch and all the lives that they've been able to save and all the different avenues and pathways that are there for people to be able to reach them. Prior to this position, I got clean September 11, 2014. And prior to me getting clean, I was homeless here in Santa Cruz for a number of years. I was on stimulants and opiates. I dabbled in opiates. I was more into stimulants. And there wasn't a place in this town that I didn't live on the side of the highway or the bridges or stores that I didn't steal from to be able to obtain my habits or to be able to feed myself. I was a person within our community that that people would cross the street from. I was a person that people thought they would be able to catch homelessness from or addiction from just by the way that I presented. I would, there was times in my life where I was so beat up and so exhausted that I would fall out, and where paramedics had to show up and they couldn't tell if I was, 45 minutes to an hour of trying to wake me up. They didn't know if I was dead or alive. Whether I had overdosed or I was just that malnourished. There's multiple times in my life where I was just defeated, and that where going into a correctional facility was the only opportunity or only break that I got. There's times in my life where I showed up at a local hospital and went in and asked for help, and due to the way that I was looking, was turned away. There was times in my life where I suffered humiliation or where flying a sign on a street corner was my only avenue to be able to get money, to be able to feed myself. Long before my addiction took off, I had suffered severe trauma growing up. I had suffered childhood trauma. I grew up in a home where domestic violence was an everyday occurrence. It wasn't uncommon to see my mom get hit. It wasn't uncommon to see my brother get arrested. It wasn't uncommon to see physical altercations from schools or being bullied from not having enough. The first time I speak about this in the 12-step settings in my chair, the first time that I ever admitted or felt powerlessness was the first time I ever saw my mom get beaten. One of the times that I can recall my mom getting beaten by a man, and in the living room and running out as an adolescent and running out and being like, leave my mommy alone. And that man turned around and then struck me. And I went back into the bedroom and shut the door and left that behind and tried to forget about it. All those traumas that I faced as an adolescent and as a child are all things that I hung on to and became part of the character that, became addicted. And I shuffled through racism. I've shuffled through just not fitting in. And over this course of this 9.5 years, I've been able to work on unpacking some of that stuff. I went to a treatment program here in Santa Cruz. It was an Encompass treatment program. I went to Santa Cruz Residential. And I remember walking in the door that day and just throwing up the white flag and just wanting to surrender. And I was able to link up with a good friend of mine in there, and we got on the buddy system. And shortly thereafter, my son was born. He's a beautiful, healthy baby boy, still my little baby boy today. And I remember just being in treatment and not knowing how to cope with life on life's terms or find a way to be able to navigate through life. And personal hygiene wasn't something that I was so on top of. from coming off to be homeless. I had to have a peer or friend or somebody inside of there navigate me to take a shower every day or washing my clothes and doing laundry or for going back. I had lost what today I take for granted, just the necessities of everything in the household. I had to relearn how to walk and live. And I know that feeling when we have a client walk into our office that is coming from the same settings or same backgrounds that I came from. See, my story, unlike others, is more of an open book. I choose not to hide from my past. I choose to use that as a benefit today. My addiction at one time was my greatest weakness. It's my greatest strength today. And so how I continue to move through this process, well, I'll jump back to the residential part. And so after I graduated residential, I went back and often that became my safe place and started hanging out with people that were in the treatment center and doing this job without knowing I was doing this job and just hanging out with people and inspiring hope and change in their lives. And COVID happened and I wasn't able to go back. And I took a position as an electrician. And that was great for a long time. And a friend of mine called me up one day and she said, I have this great, amazing position. It's called a peer specialist. And I think you'd be fantastic at it. And I said, well, I don't know. I don't know if I can take that position. Because I don't know if I feel comfortable enough in my own skin at getting paid for something that I should so freely just be given to another individual. And so I've taken this position on as an opportunity to look at the ways to be able to break the barriers and remove the stigma. And some of the places it's often mostly given: the courthouse, the hospitals, the community. I'm not afraid to walk with a person that has nothing and to be seen with a person that has nothing. And nor should anybody else. I want to remove the barrier that people are sick and wanting to be able to get well, and that they need the help and not another closed door. This position for this last year that I've been in this position that Source Street has offered me has been remarkable. We've been able to go out and do outreach in other areas. Homeless encampments, to downtown, to our levee, to an armory. We've been able to inspire doing pizzas and care packages and such. My job as a peer specialist today is I think of it as a bridge builder and someone that helps to be able to fill in the gaps where people often fall through. When you walk into the office, there's this stigma, oh God, I have to speak to a physician, or God, this doctor is just not going to understand me. And when I sit into the office with that client and do that introduction and say that it's going to be okay and that we're going to work through this together, is something that brings relief to another person and somebody that understands or has an inkling of being able to say, we can do this. I did that 80-hour training to become a California peer specialist. And I think for me, the number one thing that I grabbed out of that was my job is to build hope and to inspire. Not just the person who is coming in for help, but also the person that is there to be able to give the help. There's patient fatigue all the time. There's where I've seen people just run into the dead ends, and being able to say, if we look at it this way and we do it from this point of view, is this possible? And with my team and with the community, more times than not, there's a different way to be able to skin the cat. And so it's really looking in the outside the box thinking that I think is going to be able to start to continue to save lives. My goal for this job was not to go out and save the whole community. My job for this job to make complete success is to be able to just help one person not die. Help one person be able to have the gift that I so freely live today. I dropped my kids off at school this morning. I'm supposed to be dead. The people that I got loaded with are no longer here, or they're in jail. And maybe a small fraction of them have been able to dabble in and out of the rooms. I am blessed, highly favored, and overpaid. And I just think we need to be able to bring more peers into this field, have a different view that can change lives. And that's not to take away from anything that anyone is doing, but to build a stronger community. It involves everybody. It involves all different ways of thinking. I'm not sure of my time, but again, I just want to say thank you to all the benefactors in the state of California, to all the people in my local community, for all the opportunities and the doorways that are open. And I want to thank the opportunities for the people that have closed the doors for us to reopen them in a different manner. Thank you.
Thank you, Chris. Really, really, really appreciate the vulnerability and opening up. You know, there's I seen a post the other day. I'm connected with some people at Homeboy Industries, and I seen the executive director say they'll know our story. They're gonna know our story.
Mm-hmm.
And when you're sharing, and I know the same thing with Alicia and Helen. You know, it's important that people know, you know, these stories. You know, because it really helps us all to connect as human beings and be able to really help somebody and save somebody's life. You know, it makes a huge difference when someone knows that you've come from where they come from and that you're showing them love and respect and dignity when others sometimes will turn their face from them or look the other way. So thank you. I appreciate you. And Alicia, could you share with us your experience?
Thank you, Chris, for sharing. That was beautiful. And thanks everybody for being here, to all the peer support, prospective peer support. This has been one of the best opportunities in my life to be offered this position. I feel like I've found purpose, my calling. Being peer support for Core Medical Clinic has been just a blessing in my life. Honestly, I never thought I would be here. I never thought this position could ever exist, you know, like, you know, similarly to Chris, Helen actually told me about the position 2 years ago. I was part of a panel at the Making Transformation conference, and she let me know that this is something that was coming up, and, you know, I just needed to do the training, and I could share my story and help inspire hope and those struggling with substance use disorder, and just knowing that, you know, I had an opportunity to do that one time at the conference, and that I could do that as a potential job opportunity, career. I've never been more grateful in my life. My story, I'm a recovering opioid addict, and I've been clean since April of 2017. That's when I found out I was pregnant with my son. And I presented a little differently. I actually was more, I was an isolator. I came from a very challenging childhood. My mother struggled with substance use, mainly alcoholism. I'm one of 3 kids. And I think I just had to learn to pretend that I was always okay, because I didn't have support. I didn't have a lot of family support. I kind of just had to do things on my own for a long time. And, going into my adult life, I didn't have the coping skills. And I did anything I could to mute, my feelings of pain and despair. And over time, I just it was the only way I knew how to live. And I didn't even realize that I was struggling with substance use disorder for a long time. I'm 38 now, so I've been clean for 7 years. So it took me up to 31 years old before I realized that I really needed help. And because I isolated, I didn't really reach out. And it took having to care for another human, knowing that it wasn't just me, and I wasn't just being self-destructive anymore. It was my soon-to-be son, that I had to figure it out, And when I found out about MAT treatment, I couldn't believe that was an option, And I did for a long time. I tried to live my life in a way. I was just pretending that I could do everything on my own, but I couldn't. And a big part of being in peer support, and what is so important to me about peer support, is that I can share my story and let people know that it's okay to ask for help, that they don't have to do it alone, that I've been there and I know how hard it is. And I know how hard it is to overcome stigma, because I had to do that. I did initially, especially being a pregnant person in recovery. I feel like there was a little added layer of stigma on top of that. And it really made it hard to push through my recovery. And I had a peer support specialist in my first MAT treatment program who really helped me overcome the stigma. And I think that if I hadn't had her by my side through the process, that I don't know if I would have stayed in my program. I feel like she was the support that really helped me move forward and change my life and stay in recovery and build confidence and just overcome the stigma. And I think we need to have more peer support in organizations, working with the team, incorporating resource connections. I mean, I feel like peer support we're kind of like, we're like the liaison for the clients and the rest of the team. We're like the life navigators we are the cheerleaders, we're the role model to kind of show what you can do in your life, how to do the things to overcome adversity and um sorry, this is, I think it's just been a big part of me wanting to care for other people has really helped with my recovery, and sharing my story kind of helps keep me accountable and helping those in their recovery stay accountable and sorry, I'm so nervous. Overall, I think that this position is what MAT treatment needs, what mental health feels, anything that will help overcome the stigma of getting help and people reaching out. I think that's just why peer support is so important. And I'm happy that I'm able to be a part of that.
Alicia, really
Mhm.
appreciate you. Helen. You ready, Helen? You're
Yes,
muted.
I'm
There you
kind of
go.
ready. I just want to speak to being a woman in recovery. She's right. There is another layer of stigma that comes towards women with substance abuse of any flavor. And it's tough to walk through that and to be able to have a peer support like Alicia on your side. I've seen that, and I've known Alicia for now about 6 years since she first came to the program I was at before, and she's an amazing woman. And yes, and our clients at CORE definitely gravitate toward her steadiness and her foundation of recovery, her advocacy, her ability to instill hope and to help them walk through and go to places they would never go to, even a doctor's office. So she does great. Thank you.
Helen,
Yes, Danny.
that's you. You're gonna share a little bit too? Sorry, or
Um,
maybe, or you wanna go over some of these?
Well, peer support services, we're sort of kind of coming into it in California a little later. It's been more back east in the Midwest. So this is all new. And for a long time, I kept looking for more information on how peer support worked. And I mean, I know how it is to assist people in recovery and help them, but how SAMHSA wanted us to do it, or how it had, the best way to move forward. So having the certification, would you say both Chris and Alicia, did that help in your quest? Going through the certification process and getting training, do you think that was helpful to tag on to your already profound recovery, if I might add?
Right. I can share my story, but just having the training, kind of getting the logistics of working in the field, yeah, absolutely, it helped.
You, Chris?
Absolutely. I think being able to hit the core competencies and the code of ethics, which you'll see on a slide later, has definitely been able to give me a foundation. And also, one of the things that we talk about is that we have this extravagant life before that we get here, and then we intermesh that into a professional situation and trying to find out where you have your boundaries and where how that you carry yourself. And then it's still a blurred line of what is too far and what is pure, and then what is too far. But knowing that we have the core competencies and knowing that we have the code of ethics gives us a way to be able to draw that line and use those as our tools. So I definitely think the class was the 80 hours of training was well worth it. And continued training and continued education. One of the things that we could talk about real quick is finding that, you know, your voice as a peer has a spot as a stakeholder within your communities, and using your peer support certification and specialist to being able to be an advocate and other departments.
Yes.
Gives you great strength.
That slide that's up right now is the core competencies in for looking for individuals within the training for a certified peer support specialist. And so that there's actually quite a bit to accomplish, I would say. But it does help with the boundaries, and staying within the scope of a peer support is really important. And it is a new position, and it does there are some challenges with it, but it is such a valuable position, and it can make the difference with individuals. Is there another slide after this one by any?
Yeah. Code of ethics.
There
you go.
I think, was it one before that?
Yeah, the code of ethics.
Yeah. The hope, which both of our guests said was part of their, you know, what they do is instill hope in others, and the importance of that, and the education, and being authentic, and being culturally savvy about how best to reach out to individuals. All very important.
And I would say, I'm just going to jump in a couple of minutes real quick.
Yes.
You could still do a peer support or create a peer support program, even though they're not Medi-Cal peer support specialists. Like, that's great. If your organization, like our organization, the County of Santa Cruz, we are not, our clinics are not under direct Medi-Cal, so we can't use them to be able to bill. But the majority of my MAT staff have all lived experience, and I feel like that is their glue of before they were all peers, to be able to connect with patients and to be so successful that how successful we have been. We also have done, before this came out, and Gloria put it in the chat, which is good information. We have created a curriculum that we run our patients through if they want to do it. It's basically covering all these core competencies so that are in our higher tiers of our program. And then they start through our county program, through our VIP, they start working needle exchange. We start teaching them how to get their drug and alcohol certification, how to get in school. If they want to do the Medi-Cal peer support, we start showing them the ropes for that, and just teaching them the boundaries, the ethics, and all that type of stuff. Have them co-facilitating, doing outreach in the streets. And the peer, like that peer-to-peer model is so powerful. And like you totally change tons of people's lives. You know, they get to see people that they know, that they recognize, and they can identify with them. And it just makes such a powerful impact. You know, when I first started, I would go out to homeless encampments, and some of my coworkers would be like, "How did you talk to that person?" Like, what do you mean? I just went out to talk to him. But it was because of my own experience, my own being a peer in the past. Even though I had this title now, this new job title, like I was able to go talk to this guy that was in a tent and joke around with him, clown around with him, and then get him into the clinic and get him to see primary care, get him to see MAT and all that stuff. So it's really, you know, Chris, Helen, Alicia, and the others that are on here, like it's really that's you guys are like the glue to connecting people, right? And then also be able to help them get along that path to wherever they want to be in their own recovery.
I'd like to share a quick story, if I may. I was looking at some of the questions I have. One of the questions is, what was your greatest success or challenge so far? We were fairly new into the program. It was it was like a Monday or Tuesday morning, or no, it was a Thursday morning, and I had done, my wife had done laundry, and I found $10 in one of my pockets, and I was super happy. And so I had $10 in my pocket, and I was getting off the highway, and I went to this donut shop right here in town. As I got up the highway, and I was going to go grab a donut, and I walked in. I was wearing this nice cardigan, and the other guy was matching me with a nice fall colored flannel, and we were talking. And as I got ready to walk in the store, a guy said, "Hey, do you have money so I can buy some pancakes?" And I was like, "We're at a donut shop." And I walked inside and I talked to that other guy. And then I realized he just wants food. It doesn't matter what it is. And so I walked back outside. I grabbed that guy. I said, "Hey, man, why don't you pick anything that you want, man? Pick anything from the counter that you want. You want a donut, you want coffee, you want a milk, whatever it is." And then I reached in my pocket and I grabbed one of my fancy business cards that I have now, and I handed it to him. And he looked at it. He said, "I have an appointment with you at 11 o'clock. And see, that's it. We just don't know who we're going to talk to, right? There's so many people out there that just want to be humanized, and being a peer is able to humanize that situation for them to be able to come back around and being able to come okay. And at 11 o'clock, he was there. You know, it's the small things sometimes.
You ever hear that? That's powerful, Chris. There's a saying that you can bring a horse to water, but you can't make him drink.
Absolutely.
Well, the other part of it, which I learned when I was incarcerated, being a peer mentor inside prison, is you can make them thirsty, right? And so reframing things and then showing people that they have value, right? There's a term that I like to use. I got off this curriculum, Best Life. It's called unconditional significance. Like, no matter what is, so if I usually I do like some big speaking presentation, I pull out $100 bill and I say, "Who wants this $100 bill?" And everybody usually is like, "I'll take it, I'll take it, I'll take it." And I'll be like, "What if I crumble this $100 bill up? You still want it?" "Yeah." "Why?" And then I'll keep going back and forth. "Okay, what if I rip it in half? You still take it?" "Yeah." "Okay, what if I go to the bathroom and wipe my on it? Will you still take it?" "Yes." They said, "Why?" "Because it doesn't lose its value. I'll clean it, I'll tape it up, I'll take it to the bank, it's still worth its money." And oftentimes in our lives, things that happen to us that we can't control, right? All our traumas and stuff like that. There's things that we made some poor choices and we got some pain and hurt and pain from that and some more stuff, right? But we never lose our value of being a human being, right? And when you're able to, when you understand that and you're able to give that back out to other people, you're able to show them like you still have value. I don't care what anybody else says or looks at you and what you have value. And when you're able to look at somebody like that and they like sincerely see that, like it does something for them. I remember this lady when we had a group, we were doing our MAT groups. She just got out of the jail. I don't know her from before, but she had like her head was shaved and she was just going through it, right? And I didn't know, what exactly happened, but one of the other ladies came in and we were talking about this topic. And one of the other ladies came in and she's like, "Man, that girl was so beautiful. She had long hair. She had all this stuff, right?" And we talked about unconditional significance. And that girl just got it. Like she held on to that and she like empowered her. Like, I have value, even though I don't have my hair right now because of stuff. Even though I lost my teeth because of my addiction, like I still have value. Like no matter what's going on, I still have value. And through that group process, connecting as a peer, it made a huge difference. And I feel like all of us are able to do that when we're interacting and connecting with people to show them like, you got value. Doesn't matter what you did, doesn't matter what happened to you, you still have value. You have how do you say it? You never lose your value. You have that potential forever, And so just trying to instill that in people, even if that's, you can't make them drink, you're making them thirsty because they've seen your life, Chris. They're seeing your life, Alicia. They're seeing your life, Helen, that, hey, I can do it. And it's just a beautiful thing, man. When you see them see you and they're like, wow, if he did it or she did it, I can do this too.
I'd like to add on that, Danny, real quick. Part of part of one of the things we do as peer support at CORE is we reach out to clients if they miss a couple dosing days. So we'll call them and just kind of check in with them. And I can't tell you how many times I've called and said, you know, hey, so-and-so, we noticed we haven't seen you. What's going on? Is everything okay? How are you doing? And they tell me, oh my goodness, like nobody's ever called to check in on me, you know, and we start having a whole conversation, you know, about what's going on. And then at that point, it's just, you know, I'm able to connect with them and help them with any resources they need to get them, you know, back in, or with whatever barriers are keeping them from doing that. And boom, we've made a connection, and they keep coming back and keep checking in. And that's like the greatest success to me, is when clients come in and they check in with me, and they're so excited about, you know, a goal they reached, or, you know, a goal they set even, you know, it's just, they want to continue to share that with me. And then, you know, they feel safe enough when they come in and feel like they aren't meeting their goals, and then we figure it out from there. So that, as peer support, I feel like is just one of the things that really I just really love about my job, about connecting with people, and kind of keeping them on track with what they want to do in their lives, you know.
I want to jump on to what Alicia's saying. We have 2 peer support specialists at CORE, and I don't know, 16, 17 counselors. And just the other day, our director commented that every one of the counselors absolutely find them indispensable, and that they just have added they're such a wonderful addition to the treatment venue, if you will, and have made a huge difference in people showing up, people coming back, people, you know, taking steps they couldn't take before. Their advocacy role and instilling hope and being present with these clients have made a huge difference, and they're both so welcoming to anybody that walks into their door. And it was a little, you know, starting that peer support program was a little interesting, and that's what I'm going to say, is that there was nothing to operate from other than some other places out of state. Mental health has peer support, but this was all new for us, so it was a whole new piece. And for people who are on this training, who may be thinking about it, if we could see that last slide, because I think much longer are we, by the way?
Got 15 minutes, I believe.
15 more minutes. Okay. This SAMHSA Tip 64 is very important for any organizations that considering starting up a peer support group, or not group, but, you know, staff. It's really great, well put together, and thick. So.
Okay.
I'd like to jump on that real quick, Helen, as far as how the peer support role fits into a larger organization with the counselors, because there are so many counselors. And as you said, it was interesting when we first started. However, when the counselors really started reaching out to myself and our other peer support with questions, like even if they weren't sure if it was something we could help with, just calling and asking, and I'd say 9 times out of 10 it was something that we could do for the client and help support them. Really helped integrate the peer support role into the organization. I think it really just, when we're all kind of in communication about it, and it's person-centered on the client, and it's in their best interest, I think that has really helped with incorporating the role into our organization.
Yeah,
I have a thing, I'm not a peer support specialist, but I do like the SOR3. I did the SOR2, like the GIPRAs and like the follow-ups. And so, you know, I meet them for a short period of time, but I spend like an hour, you know, with them, and then I'm over at each house. And so I make sure I sit, you know, talk to them, you know, not, you know, them and, you know, whenever I see them. And I get their information, and then with the discharge, you know, and then I have a 5 to 8 month window. And I can't count on my hands and everything. Like when I call them back, whether it's 5 months or 8 months, I usually get the response of, oh my God, Rebecca, I totally remember you. Like, you were so great. Like, you made me smile. And I'm like, how are you doing? I'm so, you know, and and I, you know, give them a gift card, and she was like, if I did use, am I not going to get the gift card? And I'm like, no, I want you to be honest. Like, you know, like, how are you? And she was like, oh, thank you so much, you know, and she told me she was struggling. And I'm like, you know, if you're struggling and you need help, please, like, I can, you know, reach out for resources for you. And if I don't know, I can ask people, you know, at the facility, like, we are here for you. If you need to come back, you know, we are here for you. Do you have our number still? You know, like, and things like that. Another person was like, you know, like, you were the person, like, why I stayed, like, you put a smile on my face on a grumpy day. He's like, I remember you so much, and like your energy. And he wasn't doing well. And other people, like multiple people ended up coming back because like after the new year, they were struggling, and they ended up coming back to Claire and readmitting. And each person thanked me, even if they were doing well, just thanked me for remembering them and checking in, you know? And I just said, you have my number, my email. If you need anything, do not hesitate, you know? And, you know, I was just like, so, I mean, I would spend sometimes like an hour and a half on the phone with somebody, you know what I mean? And some people, you know, just are doing good and they don't want to spend that long, you know, which I get. But I kind of was surprised, like, oh my gosh, they remembered me, because I'm not like a counselor that sees them every day, but I made some connection, and I believe my positivity and my energy and just being genuine, like, had something to do with it. That's it.
I'd like to have a chance to answer that other question. Thank you, Rebecca. You're absolutely, being genuine is always a way to be able to allow for it allows for the doorway to stay open. How does your role fit into a larger organization? I don't know if it's me or if I'm just spoiled, right? But I've got an awesome team. And they have been able to place me in a position and then start to build things around me to support me in that position. And it's been remarkable. And they're in our organization, Encompass right now, they're looking to be able to add more peer supports in other positions. They've really just, you know, like everybody, when this position first came out, including the peer support, you know, I love the way Tristan Mayo said it. We're building this plane while flying it. And so there's been some definite learning curves in my position. There was a moment where I spoke up and I said something about medication, and I had to remember, and I was taught, hey, leave the medication to the doctors and the nurses and the physicians. That's not your role. What do you mean? Oh, you're 100% right. And so being able to like acknowledge that and still continue to move forward, it takes a strong organization to be able to do so. Because it also takes an organization that believes in you, that you can do it. And from the jump, again, I'm spoiled. They've just rallied behind me. And we've also looked at new innovative ways of how we can reach out to our communities. And I just wanted to say that they placed me into that larger organization and then built it around me. And that's how, for me, it's really worked and been really influential in my life.
Danny, I just wanted to suggest that if people have questions for the presenters that.
There was a question, so I was trying to get to that. Someone said, and maybe you can answer that, Helen. I was wondering what the billing obstacles are for billing peer support specialists for Medi-Cal.
Clarify what they mean. Barriers.
And Lee, if you want, you can unmute yourself and ask a little bit more.
Oh, hi. Yeah, I wasn't sure if I heard correctly, but it sounded like there were problems or people aren't able to bill for peer support services in Santa Cruz. Did I hear that correctly?
I think
No.
that's what you said, Danny.
Yeah, no, so if you're not under drug Medi-Cal, you can't bill. Like our county clinics are not under drug Medi-Cal, so we don't bill. Our other county programs are under drug Medi-Cal and they bill for peer support specialists. But we do not. If we hire them on, we hire them into one of our positions, which could be a community health worker, community mental health aide. But it's not exactly the same job title as that.
Okay, thank you.
Yep. Anybody else have any other questions? I don't see any other questions in the chat.
No, I don't either.
I don't either.
Mignon had her hand up before. Mignon, where'd you go?
I think it depends on, again, who's doing the billing. There are 2 codes with Medi-Cal for 15 minutes for individual and group for peer support specialists, but you have to be certified to bill Medi-Cal. That's where these further resources are going to be helpful for anybody interested, especially the SAMHSA Tip 64 and anything with DHCS.
Yeah, and also the link that Gloria put in there too, because you can go in there.
Which one?
The link, Gloria put the link in there for peer support certification, but there's.
Oh yeah, it's right at the bottom.
Oh, that's up in there.
Yeah. Again, it's a fairly, I think mental health was advocating more with peer support, and it's kind of new coming into our field. Again, I think there was more advocacy and peer support happening outside California. So we kind of made our own thing with DHCS.
Yeah, Lilia, I mean, maybe we could talk a little offline for Santa Cruz, but there are other organizations that are billing for peer support specialists in Santa Cruz.
Hi, my name is Mignon. I didn't really have a question, but I just want to say that the peer support, I think that's amazing work. Because I know when it first came out, I attended like one of the first peer support oh my gosh.
Training your information.
Yeah, training. I'm sorry.
That's
Training
okay.
with Gloria. And it was so interesting to where as though I began to think back. I remember coming into the field and we didn't have that back in the days, you know? And I too am a recovering, substance user. and I have 27 years, but I think that is so important when you can connect to people just like you know, without judgment, without the stigma, without referring to the person as, oh, the addict, or, you know, things of that nature, because they're people. And I've been in this field a very long time, and I work in the community and all these different things. But I just want to say, I congratulate you guys for stepping up, for taking initiative in being in that role, man, because people need people like you and I. So I just wanted to say I commend you guys and thank you for sharing your story.
Thank you.
Thank you. Thank
Thank
you.
you, Gloria.